Childbirth can be dangerous for poor women in Bangladesh, though things are improving. Every year, more than 7,300 mothers die from avoidable causes, an average of 20 per day. In Bangladesh, 1/3 of adolescent girls aged 15 to 19 have started childbearing. They're practically children themselves, married and pregnant before their bodies are ready to bear a child. 3 out of 4 women still give birth at home, with no one who can assist if things go wrong. Maternal deaths in the country have fallen by 40% in the last decade. One of the contributing factors is reduced fertility, helped by the wide availability of modern contraceptives. An average woman in Bangladesh today has just 2.5 children, compared with 6.5 in the 1970s. Reducing maternal mortality further will depend on improving access to skilled delivery assistance and emergency care, and on getting more women to use these services. A joint government and United Nations project is helping Bangladesh develop new ways to meet this challenge. UNFPA, the UN Population Fund, is collaborating in this effort with the World Health Organization and UNICEF, with funding from the United Kingdom, the European Union and Canada. The project has refurbished medical facilities and trained health workers at various levels in 4 of the country's 64 districts and is expanding to 7 more districts. A key aim is to provide free maternal health care during pregnancy, childbirth and the postnatal period, including skilled delivery assistance close to where women live. In Mulvi Bazar district, the project has reopened several unused community clinics. At one, Rashana Begum, a community health worker, has been trained to conduct maternal and neonatal health care, including normal deliveries. Since she started, the number of women seeking services at the community clinic has risen steadily. The surrounding community is poor, and many of the pregnant women Rashana sees do not get enough to eat.
Out of every 10 pregnant women I examine, only 2 or 3 are healthy. Most are malnourished and anemic.
Beauty, 4 months pregnant at 16, is not well. Her mother brings her to the community clinic severely weakened by anemia, jaundice and an infection. Alarmed by her condition, Rashana tells Beauty she needs to go to the nearest sub-district health complex immediately. Sadly, Beauty cannot make her own decisions on whether or not to follow Rashana's instructions, as her family always has a final say. 2 days after visiting the clinic, Beauty's family still had not taken her to the doctor in town. Instead, they were giving her ineffective herbal treatment. The Family Welfare Centre in Kalapur was recently equipped for deliveries. Family welfare visitor Kanchan Balaroy got additional training and new clients, but not all families follow her advice either. Kanchan can manage normal deliveries at the centre or in women's homes. She can also tell when a mother needs to be rushed to the district hospital. When 18-year-old Taslima suffered from prolonged labour, Kanchan was very concerned.
The patient was suffering from labour pains for many hours, and there was no progress. I told her relatives that this could seriously harm mother and baby. She has to deliver in the hospital, not at home or in the clinic.
Despite Taslima's condition, her father-in-law, the family decision-maker, brought her back home rather than pay for a longer taxi ride to the district hospital in Mulvi Bazar. Only after Kanchan and a medical officer came to their home to convince them did the family agree to take Taslima to the hospital. Fortunately, it was not too late. After emergency surgery, mother and baby would be okay. The hospital was ready for them. Since the project provided new equipment and helped train additional personnel, the number of life-saving surgical deliveries has doubled. There is now staffing around the clock to handle emergency cases like Taslima's and more capacity to treat patients like Beauty. Her family too finally agreed to take her to the district hospital. She had to wait briefly for a bed, but soon started treatment and went home 6 days later in much better condition. To save more mothers' lives, Bangladesh also needs to make communities understand the importance of using the services now available. Educating women and communities about maternal health is another important component of the project. In villages, community health volunteers lead courtyard discussions to teach young women about staying healthy during pregnancy, how to identify potential danger signs, and where to seek services. They also provide counselling about family planning methods.
I've learned that I should take rest during the day, get lots of sleep at night, and eat more than usual.
A neighbour persuaded Dipali in her 4th pregnancy to go for an antenatal checkup. It was her first visit to the Family Welfare Centre, even though she lives nearby. Dipali previously gave birth at home 3 times without a skilled birth attendant. The last delivery was particularly painful, and this time she plans to deliver with Kanchan's help.
I want to have this baby here at the clinic.
It was community health volunteer Sriti Malika who persuaded Dipali to come for her exam. Sriti got her job after finishing high school, a first in her poor community.
When I heard she was pregnant, I went to her house. I said to the family, if she goes for prenatal care, she will know the baby's position and learn what to eat to stay healthy. After 4 visits, they agreed.
Caring for women without access to maternal health services is another priority for the joint project. In Mulvi Bazaar's 92 tea gardens, healthcare is very basic, and women have few options for safe childbirth services. However, there has been a change. At the Sanrupa Tea Garden, pregnant plantation workers now have access to a well-equipped clinic with a devoted community skilled birth attendant named Gayatri. When I started, we had a labour table and it was hard to do deliveries. There was no water supply, so we had to bring buckets of water. The women carefully listen to Gayatri's guidance on what to eat, when they're expecting, and how to space their pregnancies. Gayatri says she always listens to her clients and tries to solve their problems, and that's why they accept her advice. Oshtomi, aged 21, is expecting her 2nd child. After I gave birth, the midwife told me, if you wait 3 years before having another one, the baby will be healthy, and you will be healthy, and there will be less trouble in delivery. Gayatri's job is challenging. She once delivered 3 babies in one night, but her commitment is strong. I decided to become a birth attendant as a girl after my mother died in hospital. When I have a patient, I remember what my family faced, and I know I must help her family. Strengthening the health system is critical to reducing maternal mortality, notes Arthur Erkin, UNFPA representative in Bangladesh.
75% of the deliveries in this country still take place at home. And so it is hard to get women to the facilities. So it's also important to make sure that the healthcare providers are coming to the places where women live and where they deliver. So the challenge is, of course, to make sure that we have enough providers, in this case community-based skilled birth attendants, backed up by midwives in the facilities to provide the services from actually pre-pregnancy, during the pregnancy, and of course the delivery. And if, in the case something goes wrong, there's a backup system in the sub-district or district hospitals.
To further reduce maternal deaths and disability in Bangladesh, the Prime Minister has pledged to deploy 3,000 midwives by 2015. Hundreds of nurses are now being educated and trained to become midwives in order to manage difficult deliveries on their own, as well as to provide holistic care throughout women's reproductive ages. Fatima Akhtar has been a nurse midwife for 12 years, but she now has learned new delivery techniques and is more sensitive to women's needs. I never used to relate to the mothers during antenatal exams. Now I interact with them, learn their history and try to get close to them. That makes them more comfortable. The first certified midwives have returned to their hospitals to start using their new skills.
When someone comes for a prenatal exam, I give her advice about pregnancy and childbirth and counsel her to give birth in the hospital. When the time comes, I will conduct the delivery myself.
With UNFPA support, the Bangladesh Nursing Council is guiding the midwifery training and ensuring that it meets international standards. A 3-year direct entry midwifery program will start soon. Shuria Begum is the council's registrar.
গভীরভাবে বিশ্বাস করি যে মিডওয়াইফরা যখন ইন্ডিপেন্ডেন্ট প্র্যাকটিস করার সুযোগ পাবে তখন তারা মাতৃমৃত্যু রোধে একটা যুগান্তকারী একটা ভূমিকা রাখতে পারবে আমি এটা খুব গভীরভাবে বিশ্বাস করি
UNFPA's Executive Director, Dr. Babatunde Oshotiman, recently visited Bangladesh. He was impressed by the progress in upgrading maternal health facilities and training staff.
We know that the best intervention and the most important intervention in reducing maternal mortality is having a skilled birth attendant and, during the process of labor and childbearing. Now, what Bangladesh is doing is to position trained birth attendants to attend to women who not only at birth but during pregnancy, so that they can provide them with the education they need, with antenatal care, and with assistance during labor and childbirth. And I think that will make a lot of difference.
Dr. Oshotiman also toured the National Fistula Centre at Dhaka Medical College Hospital. The centre treats women with obstetric fistula, a degrading internal injury resulting from prolonged labour. Since UNFPA started supporting this program in 2003, nearly 3,000 patients have had surgery to repair fistula, and more than 200 doctors and 250 nurses have been trained in the procedure. Bangladesh has made considerable progress in improving the health of mothers and newborns. The government has pledged to do more, and UNFPA is assisting the effort. To achieve Millennium Development Goal 5, the country must reduce maternal mortality by a further 25% by 2015. Dr. AFM Ruhul Haq, Minister of Health and Family Welfare, is confident the goal will be met.
সিরিয়াস এই ব্যাপারে মাতৃমৃত্যু হার কমানোর জন্য আমরা অত্যন্ত সিরিয়াস সেজন্য আমরা গ্রামে গ্রামে প্রশিক্ষিত জনগণ তৈরি করছি এটা জিও এনজিও সবাই মিলে এই প্রশিক্ষিত জনগণগুলো সত্যি সত্যি যখন আমরা কাজে লাগাতে পারবো আমি মনে করি আমরা রিয়েলি খুব ভালো ফল দেখাতে পারবো আমি মনে করি 2015 সালে যে টার্গেট আছে তার নিচে আমরা আসতে পারবো বলে আমি আশা করি মাতৃমৃত্যু হার কমাতে হলে তো যেন কোনো মাই প্রসবকালীন সময়ে কোনো কমপ্লিকেশন নিয়ে যেন মারা না যায় এটাই হবে আসল দায়িত্ব আমাদের সরকারের দায়িত্ব সকলের দায়িত্ব প্রশিক্ষিত জনগণ প্রতিটি ঘরে ঘরে প্রতিটি প্রসূতি মাকে সেবা দেবেন এবং তাদেরকে ট্রেস করবেন এবং তাদের ঘরে ঘরে যে সেবা দিয়ে যাতে কোনো মা মৃত্যুবরণ না করতে পারে সেদিকেই হলো আমাদের লক্ষ্য
With better trained and educated staff and improved healthcare services, as well as more outreach to communities, Bangladesh intends to save more lives of women and children and take the danger out of childbirth in the country.